So, today we're diving into a medical case that honestly reads like a detective story. It's about a 9-year-old girl, a sudden, terrifying illness, and the frantic race to figure out what was happening before it was too late.
Just imagine this for a second. One day, your kid has a headache. Annoying, but normal. But then, within days, they're not themselves at all. That's exactly where this story kicks off, with a super common symptom that quickly spiraled into an absolute neurological nightmare.
All right, so let's start with just how fast this all happened. This case, which was detailed in the journal Case Reports in Pediatrics, is a pretty chilling reminder of how a seemingly minor problem can just explode into a full-blown crisis. Okay, look at this timeline. It shows just how terrifyingly fast she went downhill. Day 1, it's a bad headache and throwing up. By day 2, she's having these strange behaviors, staring into space, grinding her teeth. Then it gets worse. She starts having aggressive outbursts, seeing things that aren't there, and her body is making movements she can't control. By the time she gets to the emergency room, only 13 days after that first headache, she is in serious trouble. So with her condition getting worse by the hour, the doctors are in a flat-out race against the clock. They start running every test they can think of, but weirdly, each result just makes the whole thing even more confusing. Okay, so first things first, they do a CT scan of her head. This is the logical starting point. They're looking for the big, obvious culprits, right? Is there a tumor in there? Is there some kind of bleeding in the brain? Anything that will cause that kind of massive pressure and chaos. And the result? Totally clear. Nothing. And, that's both a huge relief and a huge problem. Because if it's not a tumor and it's not a bleed, then what in the world is going on? So next up is a lumbar puncture. You probably know it as a spinal tap. They take a sample of the fluid that cushions the brain and spinal cord. Here, they're hunting for signs of an infection, something like meningitis, which can cause exactly this kind of severe inflammation. And again, the test comes back normal, no infection. So now the doctors are staring at this terrifying puzzle, a young girl with catastrophic neurological symptoms but no tumor, no bleeding, and no infection. This is the critical moment, right? Their patient is getting worse, and every standard test they run is hitting a dead end. The question hanging over everyone in that room is enormous. What is attacking her brain? Just when things seemed totally hopeless, a different kind of scan finally gave them the breakthrough they were so desperately looking for. One single image was about to change everything. This MRI scan, this was the turning point. See, an MRI gives a way more detailed picture of the brain than a CT scan. And right there, you can see it, these subtle, patchy white areas. That's inflammation. It's happening in her cerebellum, which is the part of the brain that coordinates all your movement. So this wasn't some single tumor or infection. This was a widespread inflammatory attack. And with that one image, they finally had a name for the enemy: acute disseminated encephalomyelitis. We'll just call it ADEM. It's a rare, serious autoimmune disease, but now that they had a diagnosis, they could finally start to fight back. So, what is ADM exactly? Well, it's not some virus or bacteria from the outside attacking the brain. It's the body's own defense system, the immune system, that's gone haywire. Let's break down how this can even happen. So ADEM is what's called a demyelinating disease. Here's a good way to think about it. The nerves in your brain are like electrical wires, and those wires are wrapped in a fatty coating called myelin, which works like insulation. In ADEM, for some reason, the immune system mistakenly attacks and destroys that myelin. It's literally stripping the insulation off the wires, causing the brain's signals to short circuit. And that's what leads to all those chaotic symptoms she was having. So why would the immune system do this? Well, the leading theory is something called molecular mimicry. It usually starts a few weeks after the body fights off a normal infection. In this girl's case, she'd had a fever about 2 months before. Your immune system creates these little soldiers or antibodies to fight that virus. But here's the problem. Sometimes a piece of that virus looks almost identical molecularly to our own healthy myelin. So weeks later, those same soldiers are patrolling the body, they see the healthy myelin, and they think it's the original enemy. It is a devastating case of friendly fire against the brain. Okay, so now they know what they're fighting. It's an overactive immune system, and that means they can finally start a targeted treatment. And the results? Well, they were absolutely remarkable. The go-to treatment for ADEM is high-dose intravenous steroids. The goal is pretty simple. Steroids are powerful anti-inflammatories. They basically scream at the immune system to stand down, to stop the attack on the brain's myelin. And the turnaround was incredibly fast. I mean, look at this. Before treatment, her consciousness was so impaired, she scored an 11 out of 15 on what's called the Glasgow Coma Scale. It's just a way to measure consciousness. She was having hallucinations and couldn't communicate. But just 3 days after starting steroids, she was dramatically better. By her follow-up appointment, she was speaking, walking on her own, and was fully conscious, a perfect 15 out of 15. A truly amazing recovery. So this case is more than just one incredible story. It really serves as a powerful lesson for the whole medical field about the importance of looking past the obvious answers. So what are the big takeaways here? Well, first, ADEM is rare, but it's serious, and it hits kids most often. It usually follows a simple infection. Second, it's really tough to diagnose because there's no single blood test for it. The MRI is absolutely key. And finally, and most importantly, as this case shows, if you catch it early and treat it fast with steroids, the chances of a full recovery are actually very high. This quote from the actual case report, man, it really says it all. Recognizing that common symptoms, like a headache, could be something more is a huge challenge for doctors. But failing to do so, not recognizing it early, that can have life-threatening consequences. And that really leaves us with one last big question. This girl's story had a happy ending because her doctors solved the puzzle just in time. But it really makes you wonder, doesn't it? How many other rare diseases are out there just hiding behind everyday symptoms, waiting to be found?